When we get to 2030, a whole lot of realizations will have occurred. First of all, throwing more people and money at healthcare isn't going to work. It's an overwhelming problem. The expectation of patients is on the rise. The way we depart this life is becoming ever more complex, and we're going to have to bring in a whole lot of technology. At an academic level, I'm a professor of sentient systems. At an industrial level, I have my own company and I'm a consultant engineer and scientist. And at the most basic level, I'm a husband and father like everybody else. The reality is, an MD, a professional of any kind, cannot keep up with the pace of technological change. I've got a huge number of sensors. Everything I can get a tester for, I buy one. And that autonomy, I think, is the only way we're going to get services like the NHS to work. We're going to have to go from this culture of do it for me to much more of a culture of do it yourself. I think the ace in the hole for the medical profession is linking these devices together and linking them to the hospital. We're now rolling out AI, and it's patient-centric AI, not professional-centric AI. But you can talk to AI and you can say, I've got a sore throat. And it will give you a diagnosis and it will suggest some treatment. But here is another I think a really pertinent point for all professionals, but specifically for terrifically skilled professionals like surgeons and consultants. Say a surgeon does 10,000 operations. How many people can he or she pass that experience on to? Now, when that becomes an AI system, or better still, when it becomes a robotic system, one machine learns something, all 60,000 machines learn it instantaneously. This is, to me, magic. When we move to more robot assistants or autonomous robots doing surgery, it's a game changer. As an engineer, I have a sort of very simple view of technology and procedures. What's the upside and what's the downside? It's the same with every piece of technology that we have. Nothing is perfect. Things will go wrong, but what you try and engineer always is to minimize the go wrong. We are having more and more artificial implants. We are on a trajectory as a human species to become more and more cyborg. The future is absolutely about medicine for one, a market of one, a medicine for one. Something that works for my body may not work for yours. AI looks as though it's going to be able to solve the protein folding. So regular computing cracked the genome decode. Decoding the protein folding will take artificial intelligence. But the golden egg is the communication between genome and protein. To crack that one, we most certainly need quantum computing. It's a real golden target. If we could crack that, we could probably reprogram out an awful lot of failures in human beings.
My summary, my take home from Peter's really interesting insight is that the future of healthcare is bright. There's nothing to fear, but there are a lot of legal issues we will need to grapple with as the NHS develops, as healthcare industry itself develops and interacts a lot more with the private sector like Google and Facebook and Microsoft. There will be a lot more need to cooperate, but I would have thought patient outcomes, patient safety will improve, and hopefully there'll be fewer claims.